I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on when should I remove my pterygium. Now, we live in Australia and there is huge amounts of UV out there, and pterygium is a ultraviolet light associated disease. And to remind you, a lot of that light comes from the side and behind. So pterygia are not unusual. You can get them in one side of the eye, in both sides of the eye. You can even have four, two in each eye. But the question comes, when should I have it removed? Well, that's a very tricky one in that there are so many different symptoms that you've got to work out what's bothering you. But here are the common indications I say to patients you might want to consider removing it. Firstly, if it's persistently red and that's interfering with your work or life. And when I say interfering, if a policeman pulls you over and starts saying, "What have you been drinking?" then we've got a problem. If you go to work and your boss says, "You've been up late night partying," then you've got a problem. Redness is an issue. That's the first thing. The second thing is if it's causing you to lose vision, then you want to start thinking about having it removed, because the worse it gets, the more vision loss, the harder it is to restore your vision. Nextly comes discomfort. If it's really just uncomfortable, dryness, different in conditions, whether you're going from a sauna to a freezer, whatever your work life is, if it's causing you irritation and discomfort, it's time to get it removed, because that tends to spiral out of control. Another important time to remove it is if you have cataract and you're coming up for cataract surgery, because the pterygium changes the shape of your eye and affects your vision. To get accurate measurements and the best outcome of your cataract surgery, remove the pterygiums first, get the surface all sorted and stable, then go on to your cataract surgery. And finally, this is really important. If it is changing or if it is suspicious, then it's time to both either biopsy it or remove it and check it to make sure it's not cancerous, and we have another video on that. So I hope that helps you in your decision-making process. That's when to remove the pterygium. Treating it with drops is a very separate issue. Thanks again for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.